Thanks for rejoining us at Life by Randy. I am headed over to Elite Healthcare in downtown Sandusky, Ohio for a conversation with Dr. Elizabeth LaFay. This is a follow-up to our video we did on the prescription for calming the mind, otherwise known as meditating or contemplative prayer. We discussed in that first video, you don't want to miss that one, because we talk about all the medical benefits of meditating, the scientific, physiological benefits and changes in the body of meditating. And this video is actually a how-to. We talked about so many things in the first video that we didn't want to make it too long, and we decided to break the video up into two parts, and this one is how to meditate. If you're wondering how to do it, we're going to take the mystery out of it, and we're going to give you some examples and some tools and tips on how you do it for the beginner so you can enjoy the health benefits as well. Thanks for tuning in. Come on, let's take a ride with me. Well, we're now here at Elite Healthcare with Dr. Elizabeth LaFay to talk about the practical side of meditation, to take the mystery out of meditation. More and more physicians are prescribing practices to calm the mind, otherwise known as meditation or contemplative prayer. We're going to go through some of the different kinds of meditation today, and we're going to get Dr. LaFay's expert counsel on meditation. And we're going to begin with a quick review of the health benefits. Dr. LaFay, welcome.
Hi, thank you for having me again, and thank you for being here.
Oh, you're welcome. It's a great space, and we just made you for the next video, a tour around the place and what new patients can expect. So stay tuned for that. That's a little teaser. But for this video, Dr. LaFay, you are one of those physicians that prescribes some kind of meditative practice. Why do you do that?
There are so many health benefits. I know we discussed this primarily in our most recent video, and just to recap briefly, anything related to stress is affected by meditation positively, or mindfulness, peacefulness in the brain. And most diseases, as I say over and over, are related to stress. So lowering your blood pressure, lowering your cholesterol, any kind of emotional well-being, IBS, which is irritable bowel syndrome, and other digestive type things, because the opposite of fight and flight is rest and digest. Sleep issues and anorexia, anxiety, insomnia, and really one thing that gets so many people interested is that if you can get into a place where your brain is calm and be there even for a few minutes, it's similar to a workout when you're talking about the ability to budge pounds. And at the risk of going down a big conversation with that, I would refer our listeners back to our most recent video.
It is very difficult to turn your mind off.
It's really tough, I think, too, to convince patients that they can get ahead by slowing down, because it's so counterintuitive to everything that we celebrate here.
And I understand that there are different types of a meditative practice. So we hear a lot about mindfulness. Let's start there. Mindfulness is a meditative practice, and I know that you and Liz, your nutritionist on staff, has been working with me on being more mindful about sitting down to eat a meal, because digestion starts at first looking at your plate. Okay, mindfulness. What does that mean?
Quite simply, it's sort of the old adage of stop and smell the flowers. Our brains very often are wired to just think, and ding, 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 running through that to-do list, making constant observations, and almost like this peanut gallery, just chirp, chirp, chirp. And so to step back away from that a little bit and observe those thoughts, and maybe observe more than just your thoughts around you, because you're not sort of in that melee, So number one, observe your thoughts. If you can't slow them down, just one thing I read along the way was to imagine them as clouds sort of floating across the sky of your mind. So that's really a place to start, taking some really full deep breaths and triggering that vagus nerve that you love so much. And what that does is immediately start to calm you down, because the vagus nerve, one of the things it does is decrease your heart rate when it's triggered. So, getting a full deep breath, maybe holding it a few minutes, expanding your lungs to a point past when you would normally breathe, getting really full, and then pausing and then exhaling, and just doing 2 or 3 of those can just slow things down a little bit.
So before we move on, just to camp out on that vagus nerve, because I love to know, and I need to know, the whys. And once that makes sense, it forever makes sense to me, and I do that. So we hear about breathing, breath work, belly breaths, deep breathing, or even when someone's stressed out, what's the old adage? Just take a deep breath.
Yeah.
Well, that relates to the vagus nerve, because physiologically, Dr. LaFay, what happens when you take that big breath?
You're literally stretching that vagus nerve a little bit, which goes right through your diaphragm, and the diaphragm is the layer that separates, your chest from your abdomen. So that moves when you take a deep breath in. It triggers the vagus nerve. Everything starts to just be chill. It releases a chemical called acetylcholine nearly immediately, and that triggers what's called the parasympathetic nervous system, which is the opposite of fight or flight. Most simply said, rest and digest. So that allows your body to just slow down a bit.
So it produces a chemical response in us that is the effect of taking a chill pill,
calming,
but it's natural.
Yes, absolutely, and nearly immediate. After 3 deep breaths, you feel differently. And that's why. So then you can start to hear the birds a little bit, or maybe smell a flower next to you, or notice someone sitting next to you, and maybe they need a quick conversation or something. It gets you out of your own head really quickly. So it's lovely to do in an acute situation. I like to do it when I'm, you have those few moments here and there where maybe in the olden days somebody would pause and smoke a cigarette because that was a gap filler. It's my gap filler. If I'm sitting at a stoplight, I'll take a deep breath, try to notice something outside of where I'm going, what I'm doing all the time.
Right.
So that's the most simple, most applicable. So again, meditation is such a trigger word. People immediately go to transcendental and chanting and weird, and mindfulness, a couple deep breaths, that's the same category. And you can do it walking through town. So it doesn't have to be hard. It doesn't have to be, in the perfect nook with the perfect cup of coffee and the cat curled at your feet for an hour. It doesn't have to be in a class that you force yourself to go to. It can just be that simple and in the fluid of your life.
Beautiful. We can all do that, and we all need that. And if we're mindful of the shallow breaths we take, almost to just barely to exist and get enough oxygen to make it to the next moment.
Yeah.
I know that I do that. It's like, Randy, breathe.
Yeah, you realize you're guppy breathing.
Yeah, guppy breathing. So no guppy breathing. How about focus kind of meditation? Maybe focusing on a candle. You light a candle. That can be a spiritual practice. Some denominations light candles and for offerings. So what would be kind of a focused meditative practice?
So I would start that by saying, I think a big myth with meditation is that you have to close your eyes. I prefer to do that most of the time because it helps me focus. However, some people just really don't like that. They get spooked really quickly, not noticing their surroundings, and it doesn't resonate with them. So, you may be shocked to realize you don't have to close your eyes when you meditate. It does help if you have something to focus on. And a candle flame, whether it's part of a spiritual practice or just a candle that you light, a campfire, because it has all the dancing flames. There's like all kinds of screensavers that have different colors coming in and out, or you can focus on a beautiful tree in your backyard or rippling water. Water is a big one because it also has this really nice calming noise. But those are really acceptable. Really, any focal point you want to choose can be really calming. And I like the ones that kind of move or change a little bit when I am trying to be calm in the moment and can't close my eyes.
And so how long would, say I'm going to light a candle and stare at the flame, how long should I do that? Or how long is it recommended to get health benefits?
So genuinely you only need a couple minutes a day to get a health benefit from it routinely. What I would say is that it depends on how long you have and how long it takes, because really the goal is to get your brain to a place of peace. For some people that takes a couple minutes, and for others, and maybe depending on the day, it can take much longer than that. The really cool thing is, even if you don't get your brain, what I kind of slangily say, all the way down, you still get really nice health benefits from it, and they get progressive as you get progressively better and better at it. But just even spending a couple minutes there is really helpful. And then, it doesn't have to be an hour, half an hour. In fact, especially in the beginning, I would say just set a goal of a couple minutes, nothing more than 12. It is. Oh my gosh. Yeah. Yes. And still, even some days now, I struggle with it. But overall, how I used to dread it and truly had to practice to get good at it. Now I just really look forward to those times when I can really settle in. So I would say, choose your length of time based on your day. If you are doing it in the morning and you get up to whittle out extra minutes and you have 5 minutes, do 5 minutes. If you have a lazy Saturday morning and this is kind of, you can relax into it and be a little carefree with the clock, then just settle in and see where you go with it.
Yeah. And I think it's important. You and I have been meditating for quite some time, me over 10 years. So I have to remind myself what it was like in the beginning. Yeah. And 30 seconds in the beginning was difficult because your body, and I don't know what part of the body, is driving this. What is it? The sympathetic nervous system. But I would just try to settle in and put in my earbuds and put something on, put a guided meditation on YouTube for a couple of minutes, and I'd have an itch on my ankle. And then I'd have an itch on my back. And I once heard then, let the itch go. Notice the itch and let it go, because it's your body saying, no, I don't want to relax. I'm not going to do this, right?
Yes.
And then I didn't love the dishwasher. And did I pre-treat that stain on those white jeans? And then before you know, I'm like, I can't do this. I can't tell you how many times I did that at the beginning for months. My body wouldn't settle down. Is that typical?
So typical. I can't tell you how many patients come back and they say, I tried that meditation thing you were talking about and I'm just not good at it. And then I just chuckle and say, yeah, none of us are. It definitely takes a little practice. Not that I'm trying to be Debbie Downer or intimidate someone from trying it. But the way to better respond to that is notice the itch, notice the thoughts, treat them like clouds, and don't label it failure. Don't label it anything. Just notice it. Don't judge it. Thank you. Yes, just notice it. And I think that's the biggest fallacy, especially in the beginning, is giving up before you really get started.
Yeah, so that's important. So if you turn something on after this and you simply can't do it, that's typical. It's normal. You wouldn't be normal if you didn't do that.
Right.
We can't just unplug and go to a happy I know. But with practice though, it does get, I want to say, addicting in the positive way, because you need that time, you want that time, you crave that time.
Sure.
It's your own private time out. right? You put
Absolutely.
yourself in timeout.
Yes, I mean, when you have a sense of wonderful calm and peace and you get a taste of that, and especially if you haven't had it in years, you want to have it again.
Yes, yes. And you're different moving out of that meditation space. You're like, oh, that's really good.
Yes.
Right.
Yeah. And for a while, you kind of only feel that way immediately after your session. And then eventually that starts to seep into daily life a little more, so that, as stressful times come, which is a pretty guaranteed thing,
Yep.
that your initial response isn't, squirrel brain. It's, oh, okay. And this is happening now. And we're going to have some thoughts and deal with the situation.
You kind of jump outside yourself and be the conscious observer. I didn't coin that term, and I've learned that from Dr. Bruce Lipton and Dr. Joe and Dispenza, and I'm sure others. But jump outside and not react, but wait and then choose my response to it, not in a triggered fashion, in an out of control fashion.
Yes.
It's like, okay, that's all right.
So much easier to do that. I mean, just think about an argument with your spouse or your child or your teenage daughter being very hormonal and irrational. It's so easy to be triggered when you're fried and you have 18 things you're trying to get done at once. And, if you have that same scenario, but you're not fried and you feel calm inside, then as you're unloading the groceries and thinking about bringing in the mail and the fact that you have to switch the laundry over and your daughter now is screaming at you, you can just kind of observe her. And it almost brings so much more humor out in your life.
Yes.
Where before that might trigger you, now you're like, oh my goodness, look at her acting ridiculous, and it's real, not that you're going to laugh out loud. That would probably just make the situation worse.
I've done that, but I have to apologize profusely that I'm laughing out loud in a situation that could get out of hand.
Yes.
Because I'm laughing.
Yeah.
It's a great tension cutter.
It is. And it allows you to just maintain that center of joy more often,
Yes.
Which is, you called it addicting. That is addicting. I want to be joyful.
Yeah,
So.
yeah. Beautiful, beautiful. How about movement? So I have a friend who very active, very high energy, and she has tried to sit and meditate and do what I do, which everybody's different. And through the cancer, I walked through a cancer diagnosis to cancer-free within 5 months. I meditated 4 hours a day, 4 a.m. to 8 a.m., but I was on a mission, obviously.
Yeah.
And I was well practiced, and I worked up to that.
And that's next level. And I'm in no way taking that away from you. That's amazing. I wouldn't want that to be intimidating for anyone.
Right.
And that never has to be someone's goal if they're not looking for it. However, please carry on with your story because it's amazing.
Yeah. Thank you. Yeah, that's what I built up to this over 10 years, and I had stage 4 cancer, and my way out was this. And the Cleveland Clinic oncologist, Dr. Abraham, did say that do what your mother did. She decided she wasn't going after a stage 3B ovarian cancer diagnosis with 6 months to live. And so he encouraged me to do this.
Like whatever she did, it worked for her.
Yeah.
You can do it too.
Right.
Yeah.
And what your mother did, do that. But my mom, and I interviewed her for a Mother's Day episode. That link is below, because we get through life with laughter and with making decisions and living there, adding that, of course, to our faith as foundational. But that is not typical. This is for the beginner, but because I started in baby steps all those years ago, I knew what was possible. And when you're facing a death sentence, essentially, it's like, it was such a relief for me to go out into that space and get away from my reality, quite honestly. So whether it's 4 minutes or 4 hours for the advanced person meditating, it has the same effect for me. It was very soothing to be in that meditative space.
Yeah.
In fact, I would want to stay there all day, right? Because it wasn't a pleasant reality that I was facing, but I found that frequency of
relief.
joy,
Yeah.
relief in that. Yes.
I joke, what if you could be on vacation every day?
Yep.
You can.
Yes.
That's how it feels.
Yes, it is, isn't it? Right. So that's wonderful. So the movement. So one of my dear friends can't sit, doesn't want to sit. It's not her thing. well, she walks, and she loves the rhythmic nature of that walk, and it's very meditating, and it frees up that portion of the brain that I get freed up by sitting in a chair meditating.
Yes, so there's different schools of thought on this. My thinking is if your brain gets peace with what you're doing, you're winning. So some people can't sit, especially cross-legged, which is the traditional kind of thoughts of meditation. Yes, because it's uncomfortable, or chronic back pain, whatever. So you can lie flat on the floor. Actually, I think the danger there is going too deep into meditation, and what I mean by that is falling asleep, which is just napping. It's not meditating. However, still a nice reprieve probably from reality to take a nap. So can you move? Yes, absolutely. I would say if you're out walking on a path, it's harder to get your focus internal because you still have to be mindful of where you're placing your foot, or what you're doing. And same thing with gardening, or other tasks like knitting. You're thinking through, you're thinking about your task at hand. So is it meditative? Yes, it's rhythmic and meditative. It's not quite the same as being able to shift reality maybe. And that's okay. That's still winning. How I like to think of motion and meditation is like a lot of people like to rock their body when they're getting in a place where they're trying to come down. You can kind of just rock, or in a rocking chair, a hammock, a swing, something very rhythmic like that. There are meditation paths like a labyrinth, if you've ever seen that at church centers or cancer healing centers. They're popular, and that is nice, flat, even ground in a pattern that you're sort of being guided along, usually by shrubs or a pattern on the floor, so you don't have to really think about it. You can just sort of, I think nature helps. I mean, we know it changes your frequency. It really helps get you grounded, and I think it helps to have nature sounds around you or be in nature in order to be calm faster. So where taking a walk on a nature path might, again, you're thinking about where's my dog running, or where are my feet falling on the path so I'm not tripping. That can be a little distracting maybe, but if it's calming to you, and if you're ready to really think, can I get relaxed here? Go in the woods, take a walk, hit that first bench and sit still, and maybe even close your eyes or focus on a certain leaf or the way the sun's coming through, a certain spot, and just be still.
Which again, at the beginning, very, very difficult to do.
Yes.
And at the beginning could be 6 months, or it's not just the first few times you do this.
Yes, and to someone like your friend, sitting still is not her thing. Often when they're taking a walk in the woods, they're there for exercise. So they want to take the 3-mile path, and they're timing themselves, and to just even suggest that they sit on a bench is not going to happen. So that goes back to the convincing someone that it's okay to slow down, and slowing down will actually help you get ahead faster, which is counterintuitive in our culture.
What about repetitive phrases, sometimes called mantras, but mantras can be like a meditation word, off-putting, kind of assigning Eastern religions to it. So say repetitive phrases or repetitive prayers, or some would say the Our Father, or anything that's repetitive. Is that's also a form of meditation?
Absolutely. I mean, you shared with me earlier that you like to say a certain phrase as you're calming yourself for sleep, and it makes you feel comforted. And that's essentially this example. You can say Our Father if you are a really spiritual person. The rosary is a type of that, is an example of that very thing. It doesn't have to be the ohms and the chants. I will say I used to think that stuff was weird, and I don't like to chant something over and over that I don't understand. So when it came up a few times in yoga classes, I was always finding myself shying away from that. I took the time to look a few things up to know what was coming out of my mouth. And
the Sanskrit,
and that may be important to you. I can say from personal experience that saying those things over and over sometimes certain syllables, they resonate with different energy levels with you.
Yes.
So if, for instance, your brain is having a tough time, you can say a certain syllable, versus if you're feeling like things are getting stuck in your throat and you're having trouble voicing yourself, there are different things that can really be pertinent to those situations. Yeah.
But meditation is a great prescription for all of it. At
All
least
of them.
the beginning, the first prescription, I think, right?
Just
Or,
like
yeah.
stress ubiquitously affects every disease process, meditation ubiquitously helps every disease process because it is getting you out of that stressed state.
Wonderful. So, progressive meditation. There's Dr. Joe Dispenza does this body scan. A lot of others do it, but you start at the tip of your toes. And there's also I think a Yoga Nidra is a body scan of sorts in a particular process or pattern. What about that? The progressive, I guess, is that considered like a progressive relaxation? You're focusing on something external, but really speaking to parts of your body.
Yeah, they can look many different ways. Yes, one example I love to give is my own daughter was struggling with insomnia from a very young age, and one of the things that we found that helped her significantly was something called the Sleep Fairy. And it was essentially a guided meditation that a child could relate to, and it got her to focus her brain on something, and like this interactive story went on to, have her relax, part of her body and then another part of her body. And that can be in a very adult way, sort of just rote, through maybe some Yoga Nidra or some other progressive relaxation Google searches, where it'll say, scrunch up one side of your face and then relax, then the other side, then it'll have you tighten your neck muscles and then relax, and then kind of go down the body. So there's lots of different ways that can look, but those are great, especially if you're someone who's keyed up going to bed and you need to, get your body relaxed.
Some transition.
Yes, it's a great transition time. Yes, exactly. Those are, I think, like great pre-bedtime meditations, if you will. I also like to use them before performances. I still get performance anxiety when I lecture. I love it and I'm glad to do it. However, it does trigger me. And so I have sort of these, pre-game rituals, if you will. So a lot of performance athletes do things like this, and it's very real. Yeah.
And so with the guided meditation, which I love, that's probably my top favorite. And what I did many years ago was just went on YouTube and I searched guided meditation, and for whatever I wanted, sleep, finding love, forgiving myself.
Yeah.
And recently cancer, and now the immune system. And so there's so many, they're free, and from so many fabulous YouTube creators on anything, whether Christian, Catholic, Mother Mary ones, completely Eastern tradition ones. And again, they're free. And I have my favorites, or the favorites change over time. So I hit the subscribe button and do that, and put the AirPods in and chill out. And what works for me, especially when I was going through all of my physical issues, is speaking to my cells lovingly. Directly.
Yeah. Tell us about that, because it's huge.
Thank you. And I take it for granted now that I'm on the other side of it after 2 years. So I had cancer systemically, breast to bones, and it was in my blood and bone marrow, and bigger spots of cancer and broken ribs as a result of the pathological breaks from where the cancer was. So in pain up and down my spine. But I would pick areas, or sometimes just talk to them collectively as a whole and ask them what they wanted from me. Okay, so I was encouraged by the women that worked with me to help heal me energetically. And those videos are some of the early videos. In 2021, after I got my cancer-free diagnosis, Stacy Newman a woman that I've worked with for many years, and her link will be below as well. When I called her and said, I have breast cancer, a tumor, and it's spread, and it's bad. It's going to take weeks to figure out exactly what it is, and they thought I had multiple myeloma as well, and separate bone cancer. So we knew it was horrific. And she said, stay open, loving, and curious. Name your tumor and ask what it wants from you. Ask what it's there to teach you.
Wow.
And everything is meant to help us, not hurt us. And it may look like it's hurting us at the beginning because it's causing so much pain, and you could leave this earth plane and change forms. And because my belief is we don't ever die, we just change forms, and my physical vessel was not wanting to be here. It was very sick. But I thought, what is this here to teach me? And the wisdom that came through during my quiet time, prayer time, meditation time was so beautiful. They were trying to save my life. Not only scooping up all the toxins and then congregating in a tumor, my body was working hard to save me. It's my belief and my understanding. And second, it showed me how to enjoy my life even more.
So is it safe to say that when you're saying that your body saved you, you didn't think you had a bad life before that?
No.
Yeah, so it's safe to say that you were running around very stressed and addicted to work, and priorities maybe all a mess, and this was your body giving you sort of like a body slam.
Yes, and I didn't think I was unhappy. In fact, I look back, I wasn't unhappy, but I wasn't living my best life, and I wasn't on the path I am now. And so I married the love of my life almost 5 years ago. I have a beautiful family life. Life was good. It wasn't perfect, of course, and there's always things that are working to refine your character. And
Sure.
Right? There are.
That's reality.
That's reality. But after decades, and I'll be 62 this year, after decades of burning the candle at both ends, a lawyer and in politics, and being a perfectionist on everything I did, I was like slipping down, and I didn't even know it because I didn't know any differently.
And correct me if I'm wrong, but when you're a hard worker and your career is something that you've earned and worked hard for and hard in and at for years, there is no pause button.
No.
There's no time to be sick or to slip. Instead of noticing those things and asking yourself, why are they occurring? What changes should I make? It's just, let's press harder.
Right? You have to plow through. Yes. And so we know that, right? Life doesn't stop. The groceries still need to get delivered into your refrigerator, probably by you. Do the meal planning, pay the bills, make sure the house is clean, the cars, all the things that go on, just basic living, not to mention a career or a job on top of it, and our family stresses, or on it goes. We know this. And if you're taught like I was, or I think we were, to just plow through, kind of suck it up, put on your big girl pants, just deal with it, stay in joy, gut it through, there's always a better day, and you don't even realize that that's how you're living. And so early on, a couple days after I started the diagnosis process, and it was about 3 weeks of all these tests, and you wait for the results to come back, I was brushing my teeth, getting ready to wind the day down, and that still small voice that's unmistakable said to me, Randy, this isn't so you could die, it's so you could truly live. And I just wept. And that was such a gift. And I stayed there. You know when you hear that voice. Like, I'm going to live. And I better be different after this. Yeah, that's my competition with myself. I better be different, putting that expectation. But if that doesn't change you, I wasn't learning the lessons.
Yeah.
And I'm still working on it because that's a strong, tough personality to kind of dial down and back.
I get it. I mean, not anywhere similar to your story, but I was going full head of steam consistently in the emergency room, and it was a wonderful career. I sometimes still miss it. It was fun. I didn't leave it because I was burned out. I wouldn't have described myself that way. However, this is just more the type of medicine that I meant to do with my life, and really the impact that I meant to have on humanity. It's definitely using more of my God-given talents, and I would never have described myself as unhappy before. However, what I do realize is I have energy. I have energy all the time to be there, more present for my friends and family. I have just joy at my workday now, and I am fulfilled, which is a different type of, it's a different way to live. It's a place of joy. So there's happiness, which is more circumstantial, and then there's joy, and joy is a choice. Happiness is a choice, I guess you could argue. And I feel like all of this stuff that we're talking about came out of me starting to meditate and be still and listen. And it really, quite honestly, I was mad at God for years. I could tell you stories. And it wasn't until I started being still and getting my mind calm that I could even feel a spiritual connection. And now I'm closer to God than I've ever been in my life. And I give credit to this type of work. For some people, they get there through prayer. I wasn't ready to pray. I was mad. And now I pray more than ever, constantly, actually.
It's just a part of, it's like breathing, right? And living in that state. Yeah. And so often, us humans require, a baseball bat to the head. I wish I didn't. And it's not because I'm stubborn, but I am stubborn in the sense that I can power through anything. Mm-hmm. Just because you could power through something doesn't mean you're supposed to.
Right. Yeah.
And so really, I would love to have this be an encouragement that before you get that big baseball bat, and I had a couple of them, and I am now purposing to no longer need that.
Yes.
And to go, okay,
yeah.
Got it.
Yeah.
We're going in a different direction. And that's what Life by Randy's about. I don't know where this is going. I know it's going somewhere. And if it helps one person, we've done our jobs. And of course, it will organically spread because we're here to share our experiences.
Genuinely. I call it living in the flow. So to not need a baseball bat, you used to just do the next thing and do the next thing, and you did it because it was supposed to be done, or for whatever reason, that was the plan. And now if you're calm all the time and your thoughts are not running your life, then you have a minute to pause and just sort of know if it feels right before you proceed.
Right. Or if you should be doing it. Just because you can do it or someone asked you to do it doesn't mean it's what you're called to be doing.
Yeah.
Being a little more choosy with the time. And definitely joy is a choice. Joy is a choice.
Yeah.
And there's a frequency to that. And it's a beautiful way to live.
It is, yeah.
And it starts with the meditation journey, making that decision.
Yeah. More directed and less reactive.
Yes. So how about if we finish with modeling what that breathing technique is, stimulating the vagus nerve, and that what we could do throughout the day. And that's a great way, I think, to segue out.
Okay, yeah. I would say, first of all, just notice what you're doing now. It's hard for me to direct and do it at the same time, so maybe I'll kind of guide as though I'm having you do it, even though I think maybe you're better at some of this stuff than I am, more practiced. So if you're listening, notice how you're breathing right now. Is your mouth hanging open? Are you breathing shallowly? In general, your goal is to breathe with your mouth closed through your nose. And so anytime you're catching your mouth kind of hanging open in this shallow breathing, close your mouth, breathe through your nose, maybe take a couple intentional deeper breaths without even going whole hog. So Randy's already kind of starting to get into this state. I would have you uncross your legs, maybe sit up straight if you're seated, stand still and give yourself a little bit of a wider, like maybe hip distance feet, especially if you're standing up. Just let your hands relax in your lap. They can be up, they can be down. I prefer up usually, and sometimes I'll even close my thumb to my first finger. And then literally just take a deep breath in. I'm going to count to 4. So big deep breath in through the nose. Ready? 1, 2, 3, 4. Hold it there. 1, 2, 3, 4, 5, 6. Now a slow exhale. 1, 2, 3, 4, 5, 6. You're going to hold it there at the bottom for a count of 6. Just try to kind of exhale everything out. 5, 6, and a deep breath in again. Real full. Expand your lungs past when you are normally breathing. 4, hold it there. 2, 3, 4, 5, 6. Slow exhale. 2, 3, 4, 5, 6. Hold it at the bottom again. Push everything out. 2, 3, 4, 5, 6. And just relax. Let it go. If you felt yourself feeling winded or short of breath during that time, it's okay to release that pattern. There's a lot of different patterns like that. This is just a quick example. And so many breathing classes and techniques. It's actually fascinating. But are you feeling more calm? Are you feeling more calm?
Yes.
Yeah, it happens, and it's nearly
Get a little
instantaneous.
lightheaded.
Yeah. Okay. Then
probably
maybe
holding
don't
my
hold
breath
as
too
much. Yeah, it's okay. And that's where it I think is ideal to be seated or lying down, and that lightheaded feeling actually will go away and calm down. There is an extreme breather, Wim Hof, if anybody has heard of him. WHIMHOF, I think it is. Vim, technically. He does some breathing patterns that make you feel kind of lightheaded and high and intentionally. And there's a lot of health benefits to those, but I would call him like extreme. It's kind of like Broga. It's a different spectrum of breathing. But that said, there's something for everyone out there.
Yeah. Well, thank you.
My pleasure.
This has been wonderful. And we appreciate you so much and the work that you're doing. And we look forward to more, and certainly more time with our favorite doctor, Dr. Elizabeth Lefebvre. Thank you.
Until next time.
Until next time, and be in joy. Choose joy. Thanks for watching.